Low-dose naltrexone, or LDN, has also garnered increasing attention as a potential treatment for inflammatory alopecias, particularly scarring inflammatory alopecias like lichen planopilaris and the other variants. There are several studies that I can just briefly mention that kind of explore its anti-inflammatory properties and its ability to modulate the immunoresponse system. So in Strazula et al. 2017, this study involved a retrospective review of 4 patients with lichen planopilaris who were treated with 3 milligrams of low-dose naltrexone, also known as LDN, daily. The researchers noticed a reduction in symptoms like itching and scalp inflammation, alongside a slowing down of the disease progression. Notably, in all of these patients, LDN was tolerated well without any sort of adverse effects. So this highlights its safety, but also LDN is pretty cheap. So, it's very cost effective when it comes to using it in the long term. Next, we have Hamill et al. 2023, and this was a prospective study that was open label with 26 patients. So Hamill et al. Demonstrated significant reductions in inflammatory markers, particularly erythema. And for those of you who don't know, this would be a redness of the skin. So it's a common sign of inflammation. Not the only sign of inflammation, but a common sign of it. So reductions in this particular inflammatory markers, among others, occurred over a 12-month span with the use of LDN. Now, this study did have a lack of a control group, and 26 is still a pretty small sample size. But if anything, this isn't a harmful sort of adjunctive treatment therapy for lichen planopilaris and FFA, or frontal fibrosing alopecia. So when it comes to the low dose, typically ranging between 0.5 milligram up to maybe 5 milligram, or even if you're pushing it, 10 milligram, it seems as if, this LDN has some therapeutic benefits. In the case report by Klein et al. 2022, this report described a remarkable instance of hair regrowth in a patient with lichen planopilaris who received LDN combined with platelet-rich plasma therapy, or PRP therapy. Now, beforehand, the patient had not responded to conventional therapies, so this kind of underscores LDN's potential to reverse hair loss in scarred areas and maybe even help the current treatment that someone's using be a bit more effective. So if you're working on reducing those inflammatory signs and markers through some sort of immunomodulatory effect through LDN, that could only benefit you if you have a sort of mild autoimmune inflammatory scalp condition. And I guess to some minor extent, you're always going to have a form of inflammation when it comes to androgenetic alopecia. It's not uncommon to see in clinical observations as well as in even biopsy reports where you do see signs of mild inflammation or perifollicular inflammation around the hair follicle. Hence the term perifollicular inflammation. But I'm going to take this back and use some of my own anecdotal experience, because I also use LDN, but it has nothing to do with hair loss. I use LDN because I have a chronic pain condition. I'll get into that later. But why do people commonly use, or not commonly use, but why is it becoming more popular to use LDN for chronic pain issues? Well, LDN has also been explored in this chronic pain sense because it has the ability to antagonize the toll-like receptor 4, or TLR4, on microglial cells, which can reduce inflammation and neuropathic pain. Or at least it has the potential to help reduce this sort of neuropathic pain and inflammation. And this mechanism of action makes it an attractive option for managing conditions like fibromyalgia and complex regional pain syndrome. The immune system is often misunderstood as solely a defense mechanism against viruses and infections. And while that's true, there's also other systems that it governs, right? And this includes things like wound healing, tissue repair, and maintaining a balanced inflammatory response. In conditions like autoimmune diseases and chronic inflammatory disorders, the immune system can mistakenly target the own body's tissues, as seen in cases of lichen planopilaris. In cases of lichen planopilaris, what do you have, right? Like I explained before, you have a buildup in lipids, which causes a lipotoxicity in the tissue. Your immune system is sensing like, oh man, you have a lot of this toxic stuff, toxic material in these tissues. Let's go in and destroy the tissue that's causing this issue, destroy the cells that are causing this issue, And in that process, it leads to a hyperinflammatory state, which destroys a lot of cells and a lot of tissue structure. So, these conditions highlight how immune dysregulation isn't just about failing to fight off external invaders, but also it involves a response to internal signals, and the case in point being a toxic accumulation of lipids and cellular stress. So, like I said before, LDN antagonizes the TLR4 or the toll-like receptor 4 protein, and this is a protein that's typically on immune cells like macrophages that detect harmful signals and trigger the release of inflammatory cytokines such as TNF alpha or interleukin 6. So that's what the macrophages do, right? And macrophages, they go in there and they eat dead cells and they just kill them and poop them out. I'll just put that in some sort of rudimentary term for the audience. Cytokines are signaling molecules that regulate the immune response. But again, when you have an excessive release of those cytokines, it can lead to chronic inflammation. So LDN, low dose naltrexone, like I said previously, blocks the TLR4, and it can lead to recovery or better odds of recovery for some pain conditions and even autoimmune inflammatory conditions or inflammation conditions rather, like lichen planopilaris. So this is something to consider, right? Throwing in LDN into the mix.